Prostate health is a significant concern for many men as they age. Benign prostatic hyperplasia (BPH), commonly known as an enlarged prostate, is a common issue that can lead to uncomfortable urinary symptoms. While medical treatments and interventions are important for treating an enlarged prostate, multiple lifestyle factors such as diet can elevate these symptoms. There are multiple foods that you unknowingly consume on a daily basis that actually should be avoided if you have an enlarged prostate. Turn on subtitles, because in this video we will talk about 10 foods that you should avoid if you have an enlarged prostate. Caffeine. Caffeine is a central nervous system stimulant commonly found in coffee, tea, and various soft drinks. It's known for its ability to boost alertness, but for those with an enlarged prostate, it can pose certain challenges. Caffeine can irritate the bladder and worsen urinary symptoms associated with BPH. This irritation occurs because caffeine can act as a diuretic, causing increased urine production and bladder overactivity for individuals with an already overactive bladder due to an enlarged prostate. This can lead to more frequent trips to the restroom, particularly during the night. Reducing or eliminating caffeine from your diet can often result in noticeable improvements in urinary comfort and sleep quality. Alcohol. While alcohol is considered a social drink and is consumed by most regularly, it's also a beverage that may need to be moderated or avoided entirely if you have an enlarged prostate. Why? The answer lies in its diuretic properties and potential for increasing bladder irritation. Similar to caffeine, alcohol can lead to more frequent urination, which can be particularly disruptive during the night when you're trying to sleep. This heightened urine production can exacerbate symptoms associated with BPH, such as urgency, frequent urination, and nocturia, which is the urgency of waking up at night to urinate. Soy products. Soy products contain isoflavones, which can mimic estrogen's effects. Research on their impact on prostate health is inconclusive. Some studies suggest moderate soy consumption may reduce prostate cancer risk due to the anti-inflammatory and antioxidant properties of isoflavones. However, individual responses vary, with some men experiencing hormone level changes that could exacerbate prostate issues. To navigate this, consume soy in moderation, like tofu or edamame, and monitor your body's response. Consult a healthcare professional for personalized guidance. Spicy foods. Spices are renowned for their ability to add excitement and flavor to our meals, but when it comes to prostate health, you may need to dial back on the heat. Spicy foods, particularly those containing ingredients like hot peppers, can cause bladder irritation and exacerbate urinary symptoms associated with an enlarged prostate. The culprit behind this irritation is a chemical called capsaicin, which gives peppers their signature heat. Capsaicin can trigger a burning sensation in the bladder and lead to urgency and discomfort when urinating. For some individuals, consuming spicy foods may result in more frequent trips to the restroom and a heightened feeling of urgency, making it advisable to limit or avoid them. Artificial sweeteners. Many people opt for artificial sweeteners as a calorie-conscious alternative to sugar, particularly in diet sodas and sugar-free snacks. However, for those with an enlarged prostate, certain artificial sweeteners, particularly aspartame, may not be the best choice. Aspartame can potentially irritate the bladder, leading to increased urgency and discomfort during urination. While the evidence linking aspartame and prostate health is not definitive, it's worth considering reducing or eliminating artificial sweeteners from your diet if you're experiencing urinary symptoms associated with BPH. This can help you determine whether these additives may be contributing to your discomfort and whether symptom relief is achieved by making this dietary adjustment. Processed foods. Nowadays, processed foods have become a ubiquitous part of the modern diet, thanks to their convenience and extended shelf life. However, they are often laden with excess sodium, which can exacerbate urinary symptoms for individuals with an enlarged prostate. Sodium, a component of salt, can lead to water retention, which in turn can increase bladder pressure and contribute to more frequent urination and discomfort. This can be especially problematic at night, as sodium-induced water retention might lead to more nocturia episodes. Consequently, it's beneficial to limit the intake of processed foods and instead focus on fresh, whole foods that are lower in sodium and higher in essential nutrients. Red and processed meats. Such meats are dietary staples for many, but they may have implications for prostate health, particularly when it comes to inflammation and saturated fats. These meats, which include beef, pork, and processed options like bacon and sausages, are often high in saturated fats. Excessive saturated fat consumption has been associated with inflammation and obesity, both of which can negatively impact prostate health. Inflammation can exacerbate symptoms of BPH, such as urinary urgency and frequency. Additionally, obesity can increase the risk of developing prostate problems. Therefore, it's advisable to limit the consumption of red and processed meats and consider leaner protein sources to support prostate health. Dairy products. Most dairy foods are a valuable source of calcium and other essential nutrients, but they can be problematic for some individuals dealing with an enlarged prostate. High-fat dairy options, such as whole milk and cheese, are particularly noteworthy. The reason is that high-fat dairy products can be inflammatory and potentially worsen symptoms associated with BPH. Inflammation can lead to increased pressure on the bladder, causing more frequent trips to the restroom and heightened urinary urgency. Therefore, it's worth considering a shift toward lower-fat dairy options or non-dairy alternatives to see if this dietary change provides relief from urinary discomfort associated with an enlarged prostate. Sugary foods and beverages. Sugar, often abundant in sweet treats and sugary beverages, is a dietary component that needs to be monitored for the sake of prostate health. High sugar consumption can lead to weight gain and obesity, which can be problematic for individuals with an enlarged prostate. Obesity is a risk factor for the development and progression of prostate issues, including BPH. The excess weight can put pressure on the bladder and contribute to urinary discomfort. In addition to the potential weight-related concerns, high sugar intake can also lead to fluctuations in blood sugar levels, which can impact urinary symptoms. As such, it's advisable to reduce sugar intake and opt for healthier, natural sweeteners like honey or maple syrup when needed. Fried and fast foods. Such foods are often tempting due to their convenience and taste, but they are high in unhealthy fats that can contribute to inflammation and obesity, both of which can negatively affect prostate health. The fats used for frying are typically saturated and trans fats, which are known to promote inflammation in the body. Inflammation can lead to increased bladder pressure and heightened urinary symptoms in individuals with an enlarged prostate. Additionally, the high-calorie content of fried and fast foods can contribute to weight gain, which, as mentioned earlier, can exacerbate prostate issues. It's wise to limit the consumption of these foods and focus on healthier cooking methods and food options to support prostate health. So in conclusion, it is really important to avoid the foods mentioned in this video if you have an enlarged prostate. Whether you are a 17-year-old lad or a 60-year-old boomer, take care of your prostate. You can also check out this video we made about foods that can help treat acid reflux, and if you found the video helpful, give us a big thumbs up and subscribe to Keeping It Healthy for more health-related content.